How are you today, call a friend? Cool. All right. So we got four right off the bat. Hey, Cree, thank you for hopping in. Appreciate you being here again. Always nice to see you. And as usual, you're right on top of it using our channel's hashtag Glioblastoma Warrior. We got that. You can use Glio Gladiator. Well, we got two that we use, and Cree is always on top of it, and I love it. Hi, Summer Breeze. Welcome in. And Daisy Girl, I completely understand. Thank you for coming again. Another good day, another nice night. But please be safe. That's the biggest thing. You can hear me without having to see me. So please just be safe driving. And Sweets and Beyond, hello there. Yes, exactly like Lauren Marie demands. Okay, she doesn't really demand, but she's telling everybody, good evening, hit the like button on the way in. I really like that like button. So yeah, last night was a good night. I enjoyed talking with everybody, even when we got off track. Not talking about after I was done talking about my appointment yesterday, talking about food and everything was a lot of fun. I think, especially Cuban sandwiches. Oh, I was so tempted to go get a Cuban sandwich today, but I didn't. I didn't. So, all right, seven in here already. We just went live 2 minutes ago. So that's awesome. Thank you, everybody who's in here for joining tonight. I think that's amazing that you're here so early and just appreciate, as always, all the support I get. Call a friend had fish for supper. That is awesome. I actually, since the fair, is here through the weekend. I had I didn't get anything from the fair because I wasn't there, but I made corn dog nuggets and French fries in the air fryer. So it was very tasty, and I got my fair fix even though I wasn't at the fair. The new job, Sweets and Beyond, is going quite well. Very very happy with how it's going so far, and I don't see that changing anytime soon. So very, very happy about that. And I'm sorry if you can hear a dog in the background. Fair food is my favorite. Yes. I think I've said it before on here, but there's only two reasons I go to the fair food wise. Um, and that is a specific brand of French fries. The company is called Fiske, Fiske, and a company called Smitty's for their corn dogs because their corn dogs, their batter is like no other. It's almost like a pancake wrapped around it. It's so good and fluffy. Stouffer's mac and cheese, nice, Sweets and Beyond. Stouffer's actually makes some pretty good microwave, or even you can put them in the oven dinners. So that's pretty amazing. All right, look at all the highs. I love this. Everybody welcoming each other. That always makes me happy. So yeah, welcome to everybody. If you haven't hit the like button yet and you're on YouTube, right below where I'm pointing here, should be a little bar that has a thumbs up button, hit that thumbs up button. That means you like this and you want me to continue doing it. Hey, Maria, good evening. It's almost Friday. Um, so yeah, so hit that like button if for those who haven't. So let's talk about this. Today is my 7 month anniversary of when I had a tumor removed from my brain. And for those who haven't, Lauren Marie, oh, Maria, she gives you such a hard time, and that's so funny to see. Oh, Lauren Marie. Anyway, so for those of you who don't know the story, all of a sudden I'm driving one day. I was taking my mom to an appointment or to lunch. I don't remember, but she said I just froze up, and she's all I remember is her like grabbing him on me and shaking me and saying, "Patrick, you're about to run a red light. You're running a red light." And I hit my brakes. But yeah, so that happened. So I get back home and I couldn't walk without falling. I didn't feel dizzy. I didn't feel anything but normal, but I just couldn't get up. So I'm like, you know what? We need to go to the ER. I wasn't expecting anything. And the ER does a CT scan, and the CT scan showed that I had a mass in my head that was pushing up against my brain. And that is what caused me to fall and to have the spacing out episode, which they ended up calling a silent or an absent seizure. I'm not sure of the medical term, but it was very scary. Call a friend. And then to not think you have anything wrong with you, and even the ER doctor who was on that night shared that she's like, are you okay? I'm like, a little nervous, especially when dealing with the head. One of my best friends, his dad passed away from a glioblastoma, and she was telling me every reason why glioblastomas don't just usually show up; they grow. And then when she comes out with the images of the CT scan, she's like, "Well, you're what we like to call a zebra in the medical industry. You showed absolutely no symptoms. I had no headaches. I had no speech issues. Um, it was crazy." And so they like, well, we're going to immediately transport you by ambulance to a hospital. They're not going to do anything tonight, but you're going to be on a neuro ICU level 4 floor for a couple days. Okay, so I get transported by ambulance about 30-45 minutes from the ER that I was at. Get to the 4th floor. I mean, they wheeled me in and everything. And waiting there for me was the neurosurgeon, Dr. Oliveira, to tell me everything that was going on. They were going to get an MRI done to confirm. And the next morning, I woke up and he's like, neurosurgeon was still there. And he was like, yep. So the MRI confirmed that there is a mass in your head. They didn't know if it was tumor or what. They just, you have a mass in your head and it's pushing up against your brain. So we're going to go ahead and the next day, which was the 13th of July, we're going to go ahead and do surgery to remove it. So um, first thing that night, or I'm sorry, first thing that morning, they were in there. Patrick, you ready? Yep. Anesthesia was in there talking to me about how they were going to do the anesthesia. And I'm like, I've had a lot of surgeries in my life, and anesthesia is not new to me. So they're like, oh, hey, perfect. Sign on the dotted line because always got to give consent. So I would say after about 20 minutes of just getting prepped in the room that I was in, they said, "All right, we're ready to go." And they kicked the tires up and started wheeling me into the operating room. And so I rolled over on the operating room table. The anesthesiologist is there. He's like, "Hey, we just met a few minutes ago, and in the next 5 minutes, you're going to be out of it because you're going to be sleeping." I'm like, "All right, that's fine." And so the doctor came in. He asked me if I was ready. I said, "I'm ready, but are you ready?" And that, because you're the important one here. He's like, "Yep, I'm absolutely ready." And next thing I know, 8 hours later, I'm back in the room on the ICU floor, or on the neuro ICU floor. Uh, and my throat hurt so much. And I was trying to grab at whatever was making my throat hurt. And they're like, "Patrick, that's the tube, that's the intubation tube. Um, you've got to get, you got to get your hands down. Well, you can't pull it out." And then luckily they pulled it out because it was really, it felt like I had strep throat. It hurt so much. And yes, I agree, um, Laura Marie, that throat tube does really suck. It was bad. So yeah, I at that point, I heard my family. I was still out of it. I mean, I was obviously awake from the anesthesia, um, but I could hear my family. They had allowed them to come see me in the room. I heard some church friends, and I heard some one of my friends that has been a best friend to me since I was a child, elementary, middle school, high school. I mean, we've been friends forever. And so it was so nice to hear them, and all I could do was wiggle my toes as like a hello. That's the only way I could communicate with them. And so that was so nice. And then I started coming to more and more. And the rest, I slept that night, and then woke up the next day. And I mean, I had a little bit of soreness from where the scar, where the incision was, uh, but besides that, I had no pain. I felt amazing. And so I would say, 1 second, call a friend. I will answer that here in just a moment. So um, I was feeling great. I actually got up, went to the well, not got up. I had to have the nurses help me get to the restroom. I was dizzy. That was, I mean, think about it. I had 7.5, almost 8 hour surgery on my brain. So, of course, I was going to be busy. Plus, as my neurosurgeon told me, he goes, you had a tumor that was pressing up against your brain. Now your brain can expand and actually, grow to the size it's supposed to be. It's like, oh yeah, so you're gonna be dizzy for a while. And I was, but mainly when I walked, it was more of a vertigo. I felt the floor bouncing under me, and different things like that. But all right, so call a friend. It was on the right side of my brain, and the actual diagnosis was a right parietal lobe glioblastoma. So the doctor, or the neurosurgeon that I had, was put there for a reason. He was able to do a total gross resection of the entire tumor. So my tumor was gone. And of course, they sent it for pathology and all that good stuff. And yeah, so it was so amazing. They had me do an MRI like a day after surgery, and they wanted to confirm what he saw during surgery, and that he was able to get it all. And they did. They did it. They did an MRI, and then they also did a CT of my head, chest, and pelvis area because they wanted to make sure it didn't spread anywhere, and it had not spread anywhere. So I had what was called a primary brain tumor, which was a tumor that is develops in the brain. That's why it's called primary, because it's a primary brain tumor, because it develops in the brain. So yeah, it was quite the experience. But I won't forget that first day after the surgery. I met the physical therapy team, and they're like, in a couple days we're gonna come get you out of bed. We'll have you walk around. I'm like, I could walk now. And they looked at me like I was crazy. And I'm like, I said, I can't like walk straight up. I said, if you get me that walker over there, and I can hold on to that, then I'm good. And they did. And I walked for a while. And all the doctors who were on that floor and nurses came over, and they were looking at, and they were like, who is this person? Can you believe what we're seeing right now? And I just kept walking with that. And I would say day 4 is when I told them, I don't need the walker. I am ready. I can walk. And so they just put some of those non-slip socks on me. And oh no, I shouldn't have been mobile at all. Everything that I was doing after one day of a major surgery, they were amazed and blown away. I'll never forget one of the attending physicians. He was like talking to the nurses. Have you seen his chart? His chart is amazing. So yeah, I did that. And so, like I said, day 3 or 4, I told them I don't need the walker anymore. So they put some non-slip socks on me, and they stood behind me just in case I started falling backwards, and one in front of me, one in back of me. And I was able to walk pretty much. I wasn't the whole floor. I didn't do the complete circle of that unit, but I was able to walk to the end of the unit and then back to where my room was, and they were just amazed. So the therapist said, okay, you've graduated to your black belt. And I don't know if anybody's ever seen, they have this strap that they can put kind of around your chest and stomach area. And so that was my black belt that I graduated to. So no more was somebody in front of me. Both of them were, both of the therapists were behind me, and they were holding the strap. I hated to say it was like a giant leash. So they had hold of the leash, but I showed no signs of balance issues at that time. They were like, yeah, your right leg, which was a little shaky the other day, it's perfect. And I did a whole lap around the unit, and they couldn't believe it. So I'm a stubborn Italian who's determined to be an outlier in this fight against glioblastoma. I plan on living until 80, 90 years old. And if that's not the case, that's not the case. But that's my determination, and that's what drives me every day to get up and walk and not just lay in bed, because I don't need to be laying in bed. So, Lauren Marie, do I have any lingering balance issues? I do not. I am good. Maria, thank you. That is willpower. I was determined to show them that I could do it. Don't tell me I can't do something, because that just motivates me to do it even more. So yeah, I was so happy that I proved them wrong. And call a friend. I was in the hospital 5 days post-surgery. I needed to be there 3 days post-surgery. And to be honest, I've said this before, and I will say it every time I talk about doing this. My decision was not a smart decision, but I was getting tired because I was told at day 3 that they had that I was ready to be discharged from ICU and put in a regular room because I felt perfectly normal. I'm like, yeah, everything feels good. I had all my sensations. They came and did neuro tests on me where I'd have to squeeze fingers, tell them how many fingers they had up. They test my peripheral vision, and I blew past every one of those. So on day 5, well, day 4, I was hopeful that they're going to let me go because so I never got to go from the ICU to a regular room because there were no regular rooms available. So I spent 3 additional days in the ICU that I did not need to be there. And so, me working in the insurance industry, I'm like, this isn't fraud. I get why they're keeping me here because they don't have a room, but it's waste because when they bill the insurance company, they're going to bill all 5-6 days as being in the level 4 ICU bed. That is a lot of money. It's a lot more money than a regular bed each day. So it just blows my mind. So what I did was I was like, okay, day 4, we're going to get out of here. And I was like that close. I was told they got all the sign-offs from the doctors that they're just waiting to schedule one appointment. And that was like 7:00 at night. So I'm like, yeah, they're not going to discharge me now. So I'm like, tomorrow, I told myself, tomorrow, no matter what, I am going to request against medical advice, which is AMA. I'm going to request AMA paperwork, and I'm signing it, and I'm getting out of here because there is nothing wrong with me, and there's no reason for me to be here. So that morning, my night nurse was getting off, and she brought the day nurse in to introduce her. And I said, look, I'm actually really super nice, and I'm the easiest patient you're going to have. I said, but first thing, you're going to probably think I'm crazy because it's the first thing I'm asking you. But who do I need to ask about putting together AMA paperwork? And she's like, oh, that's me. That's me. I'm the nurse. So she did. She got the AMA paperwork signed. And then one of the hospitalists came in about 2 hours later, about 10, 11 o'clock. And she goes, Patrick, I'm not letting you sign AMA paperwork. I said, well, that's not your choice. It's my right. Yeah, AMA is against medical advice. You should never do it. And I'm embarrassed that I did, but I was so frustrated because I knew I was good. And everybody, my neurosurgeon, my medical oncologist, my radiation oncologist, they'd all come in and said, yeah, you're ready to go. You don't need to be here anymore. So if I don't need to be here, I need to be gone. So that morning I told the nurse I need AMA. And when the hospitalist came in, she's like, I'm not going to let you do it. We talked for a while. And she said that the reason she's not going to have me do it is because the insurance may not pay the claim because of that. I'm like, oh, okay. Well, what do we need to do then? She goes, hold on. All the doctors have signed off on the discharge paperwork. So we just need to get you discharged. I said, okay. So they were looking like, can you walk out of here? Do you need a wheelchair? I said, I can walk out of here. That wouldn't be a problem. And, but I'm like, look, just to make y'all happy, give me a wheelchair. But I didn't. I'm like, no. I ended up taking the, not taking, what did I get? I got the walker and took that down to the valet where my mom was. And she was right there. So I gave them the walker back and I hopped in her vehicle, and that was the end of my hospital stay. But yeah, so yeah, AMA agreed with you, Maria. That's exactly what the lady said. Insurance could really do a lot of damage to the hospital claim, and it could make me responsible for so much. And I said, fine. So she ripped the AMA paperwork up, but still got me discharged. So at the end of the day, I forced their hand and they let me go because I was ready to go. And I was healthy and got multiple high level doctor sign offs that I could go. So yes, if anybody's ever in that situation, AMA is not against medical advice. There's a reason they say that, because you sign it, it alleviates them from any type of lawsuits or anything that may happen or come down the line if something were to happen to you. So AMA is not good. Don't do what Patrick did. Just listen to me. Do as I say, not as I do. Yes, liability is exactly it, Lauren Marie. So riding home for the first time was rough. I was so dizzy. It wasn't even funny. I knew I would be, but we went right to Chick-fil-A and got Chick-fil-A. So that was great. And then my aunt and uncle had a spare walker that belonged to my grandmother when my grandmother used to use it. So they brought that up to where the Chick-fil-A was and let us have it. And I used that for that one day. And then I'm like, I'm really good. I'm stable. I don't need a walker. Like, I'm really good. I needed it that day, and so I didn't use it again. So yeah, I'm so happy and blessed that I was able to do what I was able to do. I didn't care about impressing anybody. I just, to me, if you tell me no, you can't do this, or you shouldn't be able to do this, I'm going to show you that I can. And that's why walking on the first day, and then start day two, they asked me to brush my teeth, gargle with mouthwash. I was able to do all that stuff without any problems. And then, eventually I was taking a shower. They did put a bench in there. So, okay, I used it, or I held onto the rails. But my recovery was nothing short of spectacular. But as I've shared before, and I'll continue to share it, um, um, I um, I was just, God had His hand on me. Why? That doesn't matter. I'm blessed that He did, and that I'm able to share my life and you know, my testimony and the way I do things with everybody, people who have not heard, as well as those who have. And I'm just so lucky, or not lucky, I'm sorry. I'm just so blessed that I had the neurosurgeon I did, and I had the team that I did. They are amazing. And even now, after the fact, I still have my neurosurgeon just in case. Hopefully, I'll never have to use him again. But just in case, this does grow back in the future, um, he's going to be there, and he's the one I trust. And then going out to Moffitt Cancer Center here in Florida, in Tampa, Florida, um, my nurse practitioner, Amal, and my medical oncologist, Dr. Grogan, he and her, I call them the dream team, because I couldn't have a better team. And, I'm just, man, they're awesome. I get so stoked talking about them because they're great. And then the doctor who did my radiation oncology, Dr. Greenberg, from the first time I met him, he gave me his cell phone number. And anytime let's say I was feeling nervous about something, or I had questions about how the radiation was going to go, told me to call him, told me to text him, and he always answers. He is just incredible. So I have some of the best doctors one can ask for, and they were put They were put there for a reason. So, all right, Lauren Marie. You know, I had favorite nurses, but I wouldn't say it was. I went by looks. It was how they treated me. I had one nurse one day. I don't remember their names because I had three nurses every day. Well, I had a day nurse, a night nurse, a day tech, and a night tech. So four every day. And so I don't remember their names, but there was one in particular who was just more special than the other ones because of the way she treated me, the way she talked to me. And, it was just, if I was feeling down, she would just, what's going on? I see you've been laying down today. You're usually sitting in the chair. I'm like, I just wanted to, have a day to just decompress everything. And she's like, nope, I got it. She's like, you want to go for a ride? I'm like, I would love to go for a ride. And unfortunately, it wasn't in a car. She got me in the wheelchair and started running me through the hospital. And that was great. That meant so much to me. And even down the ramps where she would let go of the wheelchair and let me just glide down the ramp. Oh, that was so amazing. But yeah, having good nurses. There were a couple of nurses I didn't like. Bedside manners definitely mean a lot. I couldn't agree more. Even I'm somebody who has struggled with anxiety, general anxiety disorder, since I was in, gosh, middle school. No, not middle school. I'd say high. Well, no, um, for we'll say 20 years. I was out of school with everything by then, and just something that just came on, and I've struggled with it. I've been on different what do they call them, SSRIs, which are prescriptions to help with anxiety, and it just that's helped. But they helped calm me when I was in the hospital. And I told my medical oncologist yesterday, I said, you need to teach a class to every doctor on how to handle patients who have anxiety. And he just laughed and he's like, I appreciate that. And the reason I told him that is because after my MRI, when it comes to this type of cancer, this brain cancer, MRIs are how you know if everything is stable or if things are progressing. And luckily, mine have all been stable. My next one is March 9th. And based on how I feel, I'm expecting that to be pretty stable as well. But they get nerve wracking. So I had my MRI on the 22nd of January, and my appointment with my neurosurgeon who scheduled the MRI wasn't until the 29th. So I had to wait a whole week wondering if there was anything in there or, what did it show? Well, when it comes to my medical oncologist at Moffitt, he actually takes the time. Um, when he reads it, he takes the time to send an email telling you the results, so you don't have to wait until your next time seeing him to get the results. Now he does so, like yesterday. If he wouldn't have written me an email when he got all the images, I would have been waiting from January 22nd until February 12th to get results. But he doesn't do that. So that's why I tell him, people, you need to teach all doctors, of course, on how to work with patients who struggle with anxiety. So yes, Lauren Marie, I agree. The waiting is the hardest part. That's where your mind starts going to places you don't want it to go to. Your anxiety goes up for no reason. And so I'm grateful for him for that. And he even told me, he goes, I'm going to have Moffitt's, all their neurology board. I'm going to have them check after me to make sure. And once that was done, which was a day later, he writes me again and says, "Hey, just wanted to let you know, um, we we got the report from the neurology board here at Moffitt, and they are all in agreement with me. There's nothing there. You have no signs of any type of tumor, any type of growth. You're stable." And so, again, if all doctors could be like that, it would be, you know, I think a lot more people would like to go to doctors because that wait is really unbelievable. And the first time I went and saw this doctor, there was one piece of information that was not included in the pathology that he got from Advent Health. And I've talked about this on a previous live. Um, um, it's sorry, Lauren Marie, stable scans. I'll have to ask that because I don't think remission, actually, I know. Remission is not something they use when it comes to glioblastoma. They use no evidence of disease or NED. So it never really can go into remission. Um, it's it's a nasty thing. So but that is what it is. Unfortunately, that it just is what it is. It's not a curable disease. So uh, curable is something I will never. Well, I'm not going to say I'll never hear that. I'm still hopeful that in my lifetime that they are able to find a cure for this. There are so many trials out there. There are so many mixtures and combinations of treatments that they're doing that have shown great progress. But the progress is still, it's to delay. The delay is to delay the tumor regrowing. Now, I saw somebody at church on Sunday. I shared it last night. So if you were here, I apologize for resharing, but I think it's a cool story. So I was sitting in church on a Sunday morning, and all of a sudden, this guy walks by and he has this cap on and he had these wires. I'm like, hey, dude. I'm like, hey, that's a neat device you have. And him and I started talking. And no, it was just, I'm like, you're the first person I've seen wearing this, whether I'm at Moffitt or whether I'm out in public. You're the first one besides me I've ever seen with it. And I thought that was cool. He has been on his. Now, he had 5 glioblastomas, not non-operable. It was unbelievable. 5 glioblastomas. He's been on his Optune for 9 years. And, when you hear stories like that, no matter how bad the disease is, it gives you hope and it gives you a reason to keep fighting and doing these lives like I'm doing. Everything I do is for you all. The support you give me, this is my way of saying thank you to you, is by doing these and keeping you updated with how I'm doing. So, wow, Lauren Marie, that's awesome. I'll ask next time to find out what the oncologist thinks, because that's awesome. But I mean, I do hope, or I hate that it regrew. And we can talk offline because I don't want you to put your brother's health information all out here. But I'd be curious to know, what stuff he tried, what treatments he tried, and stuff like that. So, do I have to take a break from Optune like every couple of months? I don't. I can be on this indefinitely, which I think is cool. So Optune recommends, and I found this, Optune recommends 75% usage. That means in 24 hours, 75. This is your they call it a blue light. Your blue light is on for 75% of the time because that blue light is on. That means you're getting treatment. But my nurse practitioner and oncologist yesterday were like, but we like and we want you to use it more. I said, that's good because I'm at 86%. And they were blown away for my first month. I do sleep with it on, and it doesn't get hot. If I wanted to, I could take this mesh cap off, and you would just see the like it's almost like a cap. So yeah, so sleeping with it is fine. Every once in a while, I'll get caught up tossing and turning with the wires, but I got so used to it, and so it's not a problem anymore. And then like if I'm going out, like I went out today a couple times, I have this nifty backpack that it goes in. So the backpack can go right around, my shoulders. I could carry it on my back. So the device is, about, it's small. Let me see. Oh, yeah. Here it is. Let's not take the battery out. Okay, so here's the device. It is not big at all. So it's not heavy. It's easier. It's easy to carry around, and so yeah, it's wonderful to have. So once I have starting this month, February. So February, March, and April, I will finish my temozolomide, which is the five chemo pills. I'm sorry, two chemo pills for 5 consecutive days in the month. So I'll finish February, which will be cycle number 4. I'll finish March, cycle 5, and 6 will be cycle. I'm sorry, April will be cycle 6. So once I'm done with that, I will be off of temozolomide chemo pills and shouldn't be on any other chemo pills at that time. So the reason is they have found that people who stay on it really long time, it can actually cause some negative effects to bone marrow, which in the long run, if you have a bone marrow deficiency, you could have leukemia. So call a friend. Have I had what yet? The temozolomide. So I started temozolomide, the chemo pills. I started that. I had to take it for 42 days back in kind of the September, October, November, December range. So I did have to take those. And that was like 200, no, it was like 180 milligrams that I took. And that was, so that was the full, they call that the full range of chemo pills. After that, your radiation ends. They do it in sync with the radiation. So after that, um, I go into maintenance mode, or I went into maintenance mode. What's maintenance mode was getting a regular MRI, which was every 2 to 3 months. And what I'm doing now, I'm doing 6 cycles. I'm about to start 4 next week of the temozolomide, 350 milligrams. They doubled it. Now you only take it 5 days out of the month. So, I haven't had any side effects from it or anything. So, yeah, so 3 more months of that, and I'm done with the chemo and I'm already done with radiation. So what I was told is that my treatment is going to be this, because I'm like, oh, so we just stop? And they're like, with the chemo, yes, because of what it does to the what it does to cause potentially cause leukemia down further. So yeah, we don't want to add that. Thank you, Daisy Girl. The chemo overall, it was a pill, which I don't know if that made it any better than the IV infusion. But I had one issue, which was the first time I took it, I woke up middle of the night nauseous as anything. So I called the doctor that day. I said, I got really nauseous, threw up last night. And he's like, hold on. And he prescribed me I'm talking about a tiny little pill called ondansetron. And that's an anti nausea pill. So I take that 30 minutes prior to taking my chemo pill, and I haven't had an issue since. So one time, and that was it. So I feel very fortunate. That was it. So um, let's see. So yeah. So after the 6 months or the 6 cycles of the extra temozolomide chemo, then done with that, done with the chemo, done, I've been done with radiation. So my treatment will be this cap. And yes, Daisy Girl, Zofran, that's exactly what the ondansetron is. So I'll have the wonderful Optune, which I love. And I will be starting what is it called? Well, I'll be starting infusions every 6 weeks for Keytruda. And Keytruda is what's the word? I can't think of the word right now. Lorimer, you said it last night. Thank you. Immunotherapy. So it's an immunotherapy. So we are keying my immune system to spot, recognize all of that, any potential cancer cells or cancer growth, and go attack them like they're supposed to do. So I want to say it's the 26th of this month that I start that. So February 26th, I'll begin that, and I'll get that every 6 weeks. And it is an infusion, so they will have to give me the IV, all that good stuff. So I just have to sit there, read a book or something. I'll see. Maybe I'll go live if I don't pray. If there's nobody else there, I'll just go live straight from my phone. I won't do it through StreamYard. Go live straight through the phone, and you can keep me company as I get an infusion. So don't worry, I won't make you watch them stick me with the needles and all that. That doesn't bother me, needles, but I don't want to, y'all don't need to see that. Yeah, I could do that, Lauren Marie, and we'll see. I usually have great veins. There's only been one time that I've gone to give blood with the other oncologist's office before I moved to Moffitt. And this guy had no clue what he was doing. So he stuck me. I said, okay, you didn't get it on the right arm. I give you one chance each arm. Here's the left one. They always get it on the right, but here's the left one. And he couldn't do it again. So I'm like, all right, you get one try. Next time, doctor will have to do without blood work. But all my stuff was within range. My white blood cells, red blood cells, very good. Hemoglobin's really good. So they're happy. Because I even asked, I would like to do a cruise in July. And I'm not trying to get ahead of things here, but, if I'm still steady and stable, I want to do a cruise in July because I can celebrate on July 13th, 1 year post-diagnosis, being alive. Not everybody gets that. Some people last 3 months, 6 months. You just, it's everybody's tumor is different. And, I have been granted a blessing that everything about my tumor is favorable towards prognosis, a better prognosis. The fact that they were able to totally resect it was very favorable. Again, it can still grow back because they love to grow back. But um, the type of tumor I had when they did the genetic testing was methylated. And with methylated glioblastomas, they are more responsive to the temozolomide chemo as well as the radiation that I had and other treatments. They are shown to be effective or respond effectively to treatments. So I've had a lot of things going for me. And, the doctor, the first time I went and saw him at Moffitt, he said he was honest. And that's one thing I love about him. He says, I've had people live up to 5 years. And I've had people live 10, 20 plus years. And with what I see in you and your stuff, your results and stuff. I lean on the upper end of that, and which was nice. He didn't have to say it. And I told him I don't hold you accountable. If not, I understand things change, but um, I appreciate you sharing that, and I'm going to do all I can to make a liar out of you. And I'm here 50 plus years. He's young. He's a young guy. I would say he's probably close in age to me, if not younger. And I'm 43. So I'll be 44 in December. Call a friend. I could go on a cruise now if I wanted to. This Optune device can go anywhere. It's actually TSA approved for flying. I have a card that it comes with that I just show TSA and I'll get right through with it. Uh, and then same with cruises. I can go on cruises. You know, I just July is special to me because that would mean that I've made it 1 year on a disease that not everybody makes it to 1 year. So to me, that's something we're celebrating. And I'd say one of the things that I've been consistent with is celebrating wins. So when they told me I was methylated, celebrating. Uh, when they told me that um, they were getting me Optune, celebrated. I love that. I was getting Optune because the other oncologist at Advent Health never even mentioned Optune. I would have had no idea if it wasn't for me doing research. And when I brought it up to this other oncologist last month, he was like, "Yeah, absolutely. We are big supporters of it." So, when you hear that enthusiasm out of a doctor, it really makes you feel great. So, when we were talking about yesterday adding the immunotherapy, the Keytruda, to my um, treatment, I said, I've been reading some good things about the combination of Keytruda and Optune. And he goes, yeah, yes, there's good results out there, and I'm all for it. Now, he had to give me some warnings for, well, there could be this side effect, there could be that side effect. Every company has to do that. So he was excited about that. And then I asked him about this. I said, look, I do my research, and there is this new trial out there. It's actually just starting phase 1 trials. I said it's called Sonobird. I'll put that in the chat. So Sonobird is the new treatment, or is the new trial. And he was so excited. He's like, yes, like just like that, yes. And he told me, he goes, I can't tell you who because HIPAA. I said, no, I'm not asking who. He goes, but Moffitt is actually going to be one of the trial hospitals. We just signed up our first patient for it. And I'm like, that is so cool. I said, I'm a nerd. Technology and all these advances blow my mind. Like the fact that I'm wearing this cap and I've got frequencies running through my head targeting only my cancer cells just blows my mind. And that is such a awesome thing to me. I nerd out on stuff like that. So with Sonobird, um, I've mentioned before the triple B, blood-brain barrier. The blood-brain barrier is in your brain or is in your head to protect your brain. So what it does is it forms a force field essentially around your brain, and it doesn't allow toxins and things to get into your brain. So even though it's protecting us, and in my instance, me with my glioblastoma, I wish it wasn't. I wish it wasn't protecting me because that stops the drugs from going through. Now, luckily, a methylated tumor, that doesn't matter. A methylated tumor, the blood-brain barrier doesn't matter because it keeps the blood-brain barrier open. So that's why my radiation and my initial temozolomide chemo treatments, they went right through. And that's why I still don't have any regrowth. That stuff went right through and was very effective at keeping everything at bay. But not everybody's that lucky. Some have unmethylated tumors, and that blood-brain barrier is closed for business. The drugs don't get through. They're not effective. So what this Sonobird trial is doing is it's using, I do this all the time. I want to say sonogram, but it's not. It's using technology to open the blood-brain barrier, which I think is absolutely incredible. So it's man, it's so cool that you know that it can just give you. And I'm sorry, it's not an ultrasound. It's ultrasound technology. So it's using ultrasound technology to open the blood-brain barrier, and at the same time, you're getting a dose of your, I forget the chemo pill that they're using with it. It's not the same one that I had, the temozolomide, but there is another chemo pill that they're using, carboplatin or carboplatin, sorry, is what it is. And it's shown some incredible results. Now, granted, keep in mind, it's only in stage 1 clinical trial. So stage 1 is still early and new. Stage 2 is okay. Stage 3 is where you want to go because that's right before it's going to be approved for major use by the FDA. So it's still a new trial, but showing so much promise. And yeah, so it's a lot of exciting stuff happening with glioblastoma. And they're looking for people. I wouldn't qualify for the trial because, one, I don't have a tumor that is regrown. So, if that were to happen, doctors like you would absolutely be on my list to put on that trial. I'm like, well, we're going to keep this tumor away for as long as we can. Hopefully it's forever, but, we both know better. Eventually it will come back. So, yeah, so that's that's me today and tonight. And again, I can't stress how much I love doing this for you all every night. And, we're getting more people. Maybe the watches aren't as high some nights, but, when I saw we had up to 15 live watching tonight, that's awesome. I think 13 might have been the previous high. And I leave all the videos out there on my YouTube. So if there's one that you missed, you want to go back and look at it, go ahead. You can ask questions in there still. I'll see those, or if you comment on the show, the video, I can see it and I can answer you. So, I'm grateful for everybody who comes in here every night, a couple of nights. You're brand new. You're just learning about me. I'm so grateful that you took time to show me support tonight by being here. So call a friend, be careful. I appreciate you being in here and participating. So, so everybody, it's Thursday. I hope tomorrow, your Friday, goes fast and you have a great Friday and an amazing weekend. So, I will go ahead and end this, give you the rest of your night back to enjoy whatever you're doing. But again, thanks for the support. I love you all. God bless everybody. And I'll see you all tomorrow. Have a great night.